Hi everyone, this module will cover populations living with low socioeconomic status. We will discuss how class status can cause barriers in accessing healthcare and what you can do as a clinician to help remove these barriers. There will be 6 topics covered in this module. We will define socioeconomic status, or SES, and explain how it is measured. You will learn how SES impacts health and the stereotypes and stigma surrounding this population. I'll explain how you can learn more, and I'll provide strategies you can use to best communicate with patients and reduce bias. A person's socioeconomic status, or SES, is comprised of 3 big variables: their family income, their parents' educational attainment, and the parents' occupational status. There are a few other variables that may impact a person's socioeconomic status, like the status of their school and neighborhood, what they perceive their status to be, or their cultural capital. SES is also impacted by their social determinants of health. These determinants of health include 5 categories: economic stability, education, health and healthcare, neighborhood and built environment, and social and community context. SES has a large impact on all 5 determinants of health, and these areas all play a role in determining a person's SES. As a healthcare provider, you will inevitably encounter people living with low SES at some point in your career. In 2019, 34 million people were living in poverty in the U.S., which was 10.5% of the U.S. population. The chart on the right shows the poverty guideline based on the number of people within a household. Not every person who is living with low SES falls within the poverty income qualification, but they still experience many of the same barriers as those living in poverty. Research shows that even people who earn twice the amount that would place them at the poverty guideline experience significant health impacts due to their SES. A strong connection has been found between health and social determinants, including SES. One study found that social determinants affect 40% of health and well-being in U.S. adults, whereas clinical care only impacts 10%. Individuals with low SES are impacted in all 5 areas of the social determinants of health. In terms of economic stability, low SES households have little wealth to buffer against the event of a health problem, especially one that is unexpected. When they face these health problems, many times it can disrupt their work, burden them with healthcare expenses, and increase the demand on family members to care for their loved ones. Education among low SES populations is also at a disadvantage. The school systems in low SES areas are often lacking in resources, which can negatively impact the students' academic progress and outcomes. These schools are at a greater risk of providing inadequate education and increased student dropout rates. Low SES in childhood has been linked to poor cognitive development, language and memory, and these impacts are shown to cause poor health and income in adulthood. In terms of health and healthcare, patients from lower social classes often do not get as much involvement in their treatment decisions. These patients also have less control of communication with their care provider, and they receive less diagnostic and treatment information. They also face many more barriers to health behaviors and have less access to care than those with higher SES. The combination of poor educational opportunities plus more difficult access to care can result in poor health literacy, which makes health behaviors and care even more unattainable. The neighborhoods and built environments in low SES areas are perceived to have more crime, unpleasantness, and untrustworthy neighbors. Many also have less access to recreation facilities, less access to walking trails, and even lack a sidewalk. As a result, these barriers can increase stress and make social connections and physical activity more difficult. The social and community context in low SES areas has also been found to contribute to chronic stress. These neighborhoods are more prone to crowding, crime, noise pollution, discrimination, and hazards. This has been linked to distress, mental health problems, and health-impaired behaviors in residents of these areas. On top of the impacts from social determinants on health, People with low SES have to face stereotypes, microaggressions, and stigma based on their social class. These become an additional burden that can impact their health and well-being negatively. For example, low-status individuals are stereotyped as lazy and incompetent, substance abusers, undeserving of welfare, and do not value education. These stereotypes can cause bias that results in families with low SES being treated very differently from those with higher SES. Microaggressions are another aspect of low SES that individuals often face. A microaggression is a subtle form of discrimination that can be ambiguous, but they have been linked to lower self-esteem, poor mental health, sleep disturbances, and an additional stressor for marginalized individuals. Some microaggressions they may encounter are mocking, being pitied by others, gaslighting, and others conflating class-based oppression with their own unrelated experiences. Overall, there's a lot of negative stigma in the U.S. culture surrounding those from low SES classes. This stigma has contributed to the incidences of stereotypes and microaggressions, which add another stressor on already marginalized populations. A stigmatized person is more likely to have reduced resources, including money, power, prestige, and social connections. Lower resources can lead to individuals losing SES or being unable to attain higher SES. This can also include job discrimination, loss of social connections, and social rejection. The stigma and loss of power becomes a cycle where marginalized individuals are not able to fully access their rights, which then traps them into the cycle of poverty. As the cycle continues, the stereotypes and stigma continue to build and restrict more opportunities. The social rejection often causes gossip and rumors to arise, which further reinforces the shame, stigma, and humiliation experienced by low SES individuals. In some cases, physicians treating people with low SES were conflicted in the best treatment to provide. They were forced to decide if they should tailor the care to the individual to make it more affordable, or should they stay consistent in their standard of care for all patients. This conflict may play a role in some disparities in healthcare quality between groups, as changing the care provided to mitigate cost could potentially lead to worse outcomes. Some patients claimed their SES influenced the number, type, and scheduling of their diagnostic tests. Due to the cost of testing, many felt that their ability to have testing done was limited, and the time taken to approve and complete the test took longer. They also resulted in physicians having less diagnostic information, and the process slowed treatment. Patients also felt that SES influenced the medications they were prescribed. Low SES also led individuals to delay or avoid seeking health care. This resulted in conditions worsening, and those who were initially avoiding the cost of care ended up enduring an even more expensive hospital visit. There are also a limited number of physicians and hospitals that provide care to low SES individuals, which can create a barrier of distance in transportation. Some patients were unable to afford gas to make the trip, and others who relied on public transportation could not find a way to pay the cost of travel. As the distance needed to attend the appointment increased, the time away from work and other responsibilities became too great for some. The cost of the appointment plus the money lost by missing work or having to hire childcare further reduced access to care, and getting time off or sick leave can pose a problem. Even among those who were able to navigate through these barriers, many claimed they were not able to get an appointment for months. Finally, marginalized groups often have a history of poor experiences receiving healthcare in the past, and many are distrustful of healthcare providers. This further worsens the problem of delaying or avoiding care. Healthcare providers may be perceived to be pill pushers, and some individuals have doubts if the care they receive would be helpful. Now we will discuss the role a clinician plays in addressing health barriers facing low SES populations. Outside of staying up to date on medical and public health research related to class-related health disparities, There are a few tools you can use in your healthcare practice to learn more about your patients. First, you can utilize your intake form to gather more details about the patient. Rather than using only the standard medical questions, you can ask about the patient's life. This could include things like their preferred style of learning, goals of care, details about their employment, their work and home environment, and more to help you gain a complete picture of their life. A second method to learn more about your patients from low SES areas is to start with screening questions, such as, do you have trouble getting to your appointment? And what kind of neighborhood do you live in? And what are you having difficulty getting food for yourself and your family? These questions will help you better understand the barriers they are facing in accessing care, and you can help them address these to maintain their health in an individualized way that suits them. Finally, one of the best ways to learn more is to understand the demographics of the area you're providing care in. This will help you understand the resources and barriers your patients are experiencing, which will help you provide the best possible care. For example, you may use your knowledge of the community to point those with low SES to helpful resources that can help them adopt healthy behaviors. There are multiple ways you can help your patients with low SES receive the care they need. The most beneficial thing you can do is break down the access barriers they are facing. You can do this by making your services more affordable and being upfront and transparent about expenses. Research shows that patients with low SES appreciate when their physicians were understanding of their economic constraints and were knowledgeable about what was covered by their insurance. Many people with low SES are inhibited by distance and time when attending appointments. You could consider providing appointment times outside of regular business hours as to not conflict with most people's employment hours. E-visits and telehealth are beneficial as well, as this allows patients to get appointments quickly and conveniently. It is important that you enhance trust between yourself and your patient. You should actively listen to their concerns and spend time getting to know them, and be sensitive to their preferences when creating a treatment plan. As discussed on the previous slide, be sure you understand the community resources in your area that offer help to low-income individuals that may help them adopt healthy behaviors and lifestyles. There may also be an existing nonprofit organization that addresses their specific situation. So listening and building trust will allow you to identify helpful resources and organizations for their specific needs. Research shows that communication between health professionals and members of lower social classes can be difficult. Patients from lower social classes often ask less questions, participate less in decision-making, and provide fewer opinions and effective responses. As a result, the health professional is more likely to become less involved and utilize less trust-building practices. This behavior from the clinician discourages the patient from being more active in communicating. This cycle is sourced from misunderstandings between the two and ends up impairing the quality of care. Healthcare providers are found to be less informative with their patients who are less educated or earn a lower income. This may be due to an inaccurate assumption by the provider that the patient is not interested in learning about health or does not understand. This causes even more disadvantage for the patient with lower educational attainment. Not only are they more passive in communicating with the provider, but the provider is likely to misinterpret this as a lack of desire or need for information. As mentioned, the population living with lower SES includes adults who are in poverty, and many members of this population are uninsured or publicly insured through programs like Medicaid. Research shows that adults in these groups have lower health literacy than adults above the poverty level. A person's health literacy is their ability to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Improving health literacy in the U.S. is essential to enhance wellness and prevent adverse health events. Therefore, it is important that you take health literacy into consideration when treating patients with low SES. There are strategies you can implement in your practice to enhance communication and understanding of patients with lower SES. First, you should work directly with the patient to promote their involvement during their visit. This may involve modeling or coaching them on the health behaviors rather than only using passive approaches like describing or providing instructions. This has been shown to spread the health benefits more quickly, as they can then model and coach their family in that same health behavior. It is important to respond flexibly to your patient's needs and be aware of the community you are serving. Rather than becoming frustrated when communication is difficult, be sure to remain patient and demonstrate empathy. Your health services should be delivered in the most understandable way possible in order to benefit the patient's health and quality of life. Bias in healthcare can be very harmful to patient health outcomes. Although you as a care provider may not be aware of your own bias, it is important to consider the potential impact it could have on your perception and clinical reasoning. A study analyzing bias in healthcare identified 6 strategies clinicians can use to reduce bias when treating patients. First, stereotype replacement involves you recognizing that your response is based on stereotypes and requires you to consciously adjust your response. Counter-stereotypic imaging requires that you imagine the patient as the opposite of the stereotype associated with them. Individuation asks that you see the patient as a person rather than a stereotype. This may involve learning more about their life and history and what caused them to seek care. Perspective taking requires you to put yourself in the other person's shoes to better understand them. By increasing your opportunities to interact with people from different groups, you're expanding your understanding of others with diverse experiences. This will help you be more culturally competent and humble when interacting with those from different backgrounds than yourself, including people with low SES. Finally, partnership building can be used to reduce bias. You should see your patient as an equal to yourself and collaborate with them with this mindset. We'll end this module with a few key points to summarize. First, it is important for you to understand the impact social determinants of health have on marginalized populations, especially in terms of low SES. As mentioned, social determinants affect 40% of health and well-being in U.S. adults, whereas clinical care only impacts 10%. People with low SES have to face an additional burden of stereotypes, microaggressions, and stigma based on their social class. These have a negative impact on health and well-being. Be sure to research and understand the demographics of the area you are providing care in. This will help you understand the resources and barriers your patients are experiencing, which will help you provide the best possible care. One of the most important things you can do as a clinician is break down the access barriers your patients are facing. Consider providing appointment times outside of regular business hours for those who aren't able to leave work during regular hours. You could also provide e-visits and telehealth services. It is important that you build trust between yourself and your patient. Work directly with the patient to promote their involvement during their visit, and use modeling or coaching rather than passive approaches. Do not assume your patient does not care about their health based on their behaviors during the visit. Their low participation or affect does not mean that they are not interested in learning about their health. Finally, reflect on your responses and your own perspective to reduce bias in your health services, and do not dismiss the role bias can play, even when you are unaware. Here are the references used in this module, which can provide you with more information if you're interested. Thanks for watching!